Hi, my name is Carrie Sampson-Samuels. I'm a member of the Umatilla, Walla Walla, and Cayuse tribes of Northeastern Oregon. We are also known as the Confederated Tribes of the Umatilla Indian Reservation. I work for the Northwest Portland Area Indian Health Board as the Community Health Aide Program Project Director, otherwise known as CHAP. And you'll hear me talk about CHAP throughout the rest of this presentation, as well as the role we are integrating into our Northwest tribal communities called the Behavioral Health Aide. So as I mentioned, I work for the Northwest Portland Area Indian Health Board. We were established in 1972 and serve the 43 tribes of Oregon, Washington, and Idaho. Each member tribe has a delegate to our organization, and they meet regularly to oversee all of the activities of our Northwest Portland Area Indian Health Board. Some of our board functions include providing health promotion and disease prevention, legislative and policy analysis, training and technical assistance, and surveillance and research. We house a tribal epidemiology center, otherwise known as the Epi Center, which provides several health promotion, disease prevention projects, and is active in Indian health policy. So this is just a visual of all of the tribes that we serve in Oregon, Washington, and Idaho. We serve several tribes. Some are small tribes. Some are large land-based tribes, as you can see in the eastern side of Washington, the Colville Reservation, the Yakima Reservation. And then as you move south into Oregon, the Warm Springs Reservation, the Umatilla Reservation, which is the one I am from in Northeastern Oregon. And then in Idaho as well, we serve large land-based tribes. They tend to have a larger tribal population and are more remote communities. But then towards the western side, we have some of our smaller tribes around the Seattle, Puget Sound areas, along the coast, and various other locations throughout, as you can see, our states. So we serve many tribes, and we have a pretty far reach as we provide many of our health advocacy, our health education, resources, and other technical assistance that is requested of the tribes that we serve. So I'm going to talk with you all a little bit today about the Community Health Aide Program. The official definition of the Community Health Aide Program from IHS is the Community Health Aide Program is a multidisciplinary system of mid-level behavioral, community, and dental health professionals working along licensed providers to offer patients increased access to quality care in rural Alaska areas. Well, we are not in Alaska. We actually have taken Alaska's model and have worked to adapt it for our Northwest tribal communities. But that's not to say that CHAP has not done amazing things in the state of Alaska, because that's really where it's proven its effectiveness. It was designed in the 1960s to serve remote Alaska villages due to the fact that many of the remote villages did not have any providers, healthcare providers, behavioral health providers. So this program was developed to ensure there was a training opportunity for a tribal or a village member of those remote communities to become trained to provide the basic medical attention that those communities needed. They would essentially radio in to physicians in the local cities of Fairbanks and Anchorage and essentially do an assessment with the provider over the phone, and they were there physically with the patient. The providers typically were, again, village members. They were very integrated into their communities. They understood their communities. They understood the language. They understood the culture. They understood the family connections in those communities. They understood ceremonies. So they were really someone centered and based in their communities that their tribal members trusted and were willing to go to seek the appropriate medical attention that was needed. CHAP is a system of allied health professionals, as I mentioned, that work closely with their providers, dentists, doctors, and other mental health professionals. There are three types of CHAPs: the Community Health Aide, which is the medical arm, the Behavioral Health Aide, which is the behavioral, mental health, and alcohol and drug arm, and then dental health aides to provide that dental care that's needed. The Northwest Portland Area Indian Health Board the 43 tribes that we serve started to really learn and hear about the successes of the Alaska CHAP program and said, well, if this program has been so successful in Alaska since the 1960s, why is it down here in the lower 48 states? Why, how do we make this happen for our tribes? So in 2016, after several advocacy efforts, the Indian Health Service initiated a temporary interim national policy on CHAP, which basically said, okay, all of the other tribal areas in the lower 48 states can begin exploring what CHAP would look like for their areas. So the Portland area really took that and started to work towards the dental health aide therapist model and begin that dental health aide therapy work. And then in 2018, the health board started to initiate some of the foundational work that needed to be developed to begin the behavioral health aide discipline of CHAP. So we're very new at this. We haven't been doing it since the 1960s. It's really been within the last 6 to 7 years that we really started to take the CHAP movement and push it forward. So we have called our project the Tribal Community Health Provider Project, and it is the umbrella project that oversees all 3 disciplines of CHAP: the behavioral health aide, the dental health aide, and the community health aide. I want to call attention to our amazing logos that have been developed by tribal artists. As you can see, the raven and the eagle logo is essentially the guardians of the people and really the guardians of our health aid programs. This design was created to represent how eagles watch over our Indigenous peoples from the skies above, not only during rough times in life, but the good times as well. And the raven and the eagle together represent the unity of clans and families. The black paint represents a warrior spirit, and the red represents our medicine people. And then our behavioral health aid logo, as you can see, the one with the eagle and the trees and the salmon. And this logo was created by another tribal artist named Corey Begay. And it really brings to light kind of what our Northwest tribes are centered around. And that again also is our eagle, our protector, that blesses our paths, our travels, and our lifestyles. Then you have the land, a resource for our food, our travel, materials, and everything that we need to live our lives. And then our river systems in the Northwest. So you'll see the water with the fish and the salmon. The salmon inside the water represents our states that we serve of Oregon, Washington, and Idaho. So a lot of thought has gone into the development of our logos. And over here on the right, the CHAP logo, that one is just a plug. That's something we are looking forward to developing in the near future. So just to break it down a little bit more about our different disciplines, the dental health aides are primary oral healthcare professionals that can provide clinical dental treatment, patient education, and preventative services. Behavioral health aides are counselors, health educators, and advocates. BHAs help address individual and community-based health needs such as alcohol, drug, and tobacco abuse and mental health. BHAs use a combination of Western and traditional, which is our tribal traditional-based practices to provide care. And then community health aides, again, our medical arm, currently work within the guidelines of the Alaska Community Health Aide Practitioner Manual to assess and provide emergent, acute, and chronic care to the residents and respective rural communities. This is the arm of our health providers that we haven't developed yet. So we're looking forward to providing a new definition to describe what CHAPs look like in the Northwest. So I'm here to talk about the behavioral health aide role. This is the latest one that we have been working the last few years to develop. It was actually the newest discipline in Alaska that was developed in the 1990s. They really realized the successes that the community health aides had in providing care to rural villages and realized that a behavioral health aide role needed to be established in sort of the same manner. So the very first behavioral health aide actually didn't start practicing in Alaska until 2009. And then, as I mentioned earlier, in 2016, they said CHAP could expand to all of the other Indian Health Service areas, which were essentially all the ones outside of Alaska. And in 2018, the Northwest Portland Area Indian Health Board began the foundational work by forming advisory groups made up of our Northwest tribes and tribal members. So who can be behavioral health aides? Well, behavioral health aides anyone can be a behavioral health aide. They are natural helpers. They have really close ties to their communities and understand the tribal traditions and the culture. They're community members. They're people you see when you run into the local convenience store or to a local community event. They are people who are often good listeners, counselors, advocates at heart. They're also, could be potentially peer recovery mentors, people who have their own lived experiences and decided that they want to help others and take that next career ladder and journey to be of service to their communities. So who do BHA serve? Well, they serve our entire communities. They serve elders, older adults, adolescents, and children. Many of our behavioral health aides kind of have a niche for different age groups. So we've had BHAs that have focused more on working with adolescents, and then BHAs that have actually found their niche working with elders. So they serve our, all generations and all age groups. They work for our tribal health organization. So the map that I showed you before, they are serving their different respective tribal health organizations on their different reservations or tribal communities. And BHAs, again, as I mentioned, also have a great amount of cultural knowledge that they are able to integrate into their workforce and their practices on a day-to-day basis. I'm going to highlight the BHA1 and the BHA2, but there are actually two additional advanced BHA levels. But the ones that we have focused on providing education programs for in the Northwest are the BHA1 and the BHA2. BHA1 provides wellness activities. They can be that person that's providing community events such as powwows, classes, drumming classes, cultural classes, different crafting classes. They can host talking circles on any specific behavioral health topic in addition to education and advocacy. They can do screening and intake referrals, crisis management, case management, and group and individual interventions. Now, the BHA2 level is a step above the BHA1 that focuses more on substance use disorders, assessment, diagnosis, treatment, and referral. Behavioral health aides need to understand really a little about a lot. And you can see the many topics that I have listed and outlined below are many of the topics they have either had lived experiences with, they have family members that have suffered from, or friends or community members they know. So they have really a close connection with all of these different topics that, again, they've either had a lived experience or that they learn and delve into through the BHA education program. So really, to break it down a little bit more, our behavioral health aides must be employed by an Indian Health Service facility, a tribe, or a tribal health organization that operates a community health aide program. Now, certification is available very soon. We have recently stood up what's called a Portland Area CHAP Certification Board, and this is a federal board that certifies all of the health aides in the Northwest. And we are actually the very first CHAP certification board outside of Alaska. So we are really proud of that step that we've been able to accomplish to ensure our health aides have this route to become certified. Behavioral health aides must practice under a master's level clinical supervisor, and they do have access to an electronic behavioral health aide manual, which is essentially a cookbook, a recipe book for how to address different situations that they encounter in providing care to their clients and patients in their communities. So now I'm going to merge and talk a little bit about the BHA education program that we have been working to establish in the Northwest. We have been working with two colleges, Northwest Indian College and Heritage University, to offer BHA programs for Northwest tribal participants. We have been sending students to Alaska, to the Alaska Native Tribal Health Consortium, and we've been so grateful for that as an option. But we really learned that in order to design this program to meet the needs of our Northwest tribal communities, we needed to ensure the education program was available to our tribes. The programs that we have been working to establish, we are currently accepting students for both of these cohorts for each school, and their initial start date will be January of 2022. So this is a brand new education program for our Northwest tribal students to begin. So we are really excited. We have actually been able to offer many benefits for students in participating in this education program through a HRSA grant, which is essentially tuition and stipend coverage, travel coverage to in-person intensives, school supplies. We cover laptops, any other kind of supplies that are needed, including internet and hotspot, and coverage for the electronic behavioral health aide manual. Another really important piece of this is that we also provide connection to an elder mentor. So someone an elder from our Northwest tribal communities that can provide that cultural connection, that guidance, and really just be a good relative. And while helping students walk through the program and provide them, like I said, with support and guidance and teachings that are needed in this field for them to continue to carry on the work that they're doing. So I just want to quickly highlight the many health aides that we currently have serving our communities. On the left are dental health aides, and on the right are the behavioral health aides that have graduated from the Alaska Native Tribal Health Consortium. And then listed below are other students from the Yakama Nation that are currently going through the Alaska Native Tribal Health Consortium BHA program as well. So not a great deal of health aides out there yet, but we are just working to build this and continue to ensure that we provide support for students to go through the program and then serve their communities. As I mentioned earlier, we do have a certification board. I just want to quickly highlight the role that the certification board plays into this. They certify all of the health aides. They also certify the education and training programs that are offered to health aides, as well as continuing education opportunities as well. And I mentioned that we have elder mentors. Well, we also have these gatherings that we are hosting now virtually, unfortunately, but they've been really successful virtually. We are offering these gathering of Northwest elders, knowledge holders, and cultural keepers opportunities where many of our Northwest elders are joining us via Zoom and providing so much cultural knowledge and guidance. We just hosted our last one on September 28th and 29th and are planning the next one right now. And you can see here that we've had several topics: matriarchal roles, LGBTQ, discussing houseless folks and how to work with them, and then pausing for some wellness activities such as yoga sessions. It's been a really great connection for our students and for our program. And then our future plans, again, as I mentioned earlier, we will be focusing on establishing the community health aide role, which is the medical arm of our program. And we are really excited to extend these medical providers into our communities, especially those that have limited number of physicians, nurse practitioners, and physician assistants working within their tribal health systems to really have our own people providing the medical care in our communities. So I want to really highlight why CHAP matters. It's got a proven history of safe and quality care in Alaska for the last 50 years. And so we know that this is a guaranteed successful program that we are going to be implementing in the Northwest. Tribes can tailor these programs to meet their own needs. It increases the number of our American Indian Alaska Native healthcare providers within our clinics. So we can walk into our tribal health clinics and recognize someone who's providing that care for us. It decreases travel for our community members to other larger urban organizations or urban hospitals to seek care. It's homegrown, culturally knowledgeable, and respected providers. So those providers can really connect with our patients and by understanding and knowing our culture and the best way to meet their needs. Creates a wraparound care and referral service for our tribes, and creates a career path for our tribal members to become integrated into the healthcare system. And we are so excited to see more of our own people providing care in our tribal communities. If you have any more questions, here's my contact information. And if you would like any more information about the program, I really encourage you to visit our website, www.tchpp.org, where you can really delve into all of our different disciplines and look at any of our materials for more information. Thank you.